heart disease, and that accounts for 1 in every 4 deaths. Your lifestyle plays a big role. Joining us now to answer several common heart questions is Dr. Jason Cuomo. He's a cardiologist with the Hospital of Central Connecticut in New Britain. Doctor, welcome.
Thanks for having me.
So brief us exactly, what is heart disease?
Simply put, the heart's a pump with 4 one-way valves and a circuit board on it. And when the pump fails, one of the valves is blocked or leaks, or the circuit board short circuits, if you like that analogy, you have heart disease. The most common kind of heart disease is coronary artery disease, supplies the heart with blood and oxygen, and about 18 million Americans are suffering with it presently. Every 40 seconds, someone in the United States has a heart attack, and coronary artery disease is the reason.
All right, what are the main risk factors for heart disease?
So hypertension, high LDL cholesterol, which is the bad cholesterol, diabetes, and smoking are the major risk factors that we can modify. Age is the biggest risk factor, and after age 45 in men or menopause in women, we see a spike in coronary artery disease. So if you have any of these risk factors and you develop chest pain or shortness of breath, despite healthy lungs, a cardiologist may be able to help you.
All right, tell us how a person can minimize their risk of heart disease.
So the American Heart Association recommends 150 minutes of cardio exercise per week, and that reduces the risk significantly. For aging Americans, it can be a simple matter of just taking a few brisk walks. The Mediterranean diet reduces risk of major heart events by about 1/3, and I talk to my patients about it every day. And of course, if you're trying to quit smoking, that'll help too.
All right, when someone develops symptoms of heart disease, what types of testing is available?
Technology's come a long way since President Eisenhower had his heart attack in the 1950s, and we now can leverage ultrasound, CAT scan, and nuclear medicine technologies to diagnose heart disease. At the Hospital of Central Connecticut, we recently obtained or added cardiac MRI to our arsenal, which is the gold standard in functional testing for heart disease and can help us to detect any inflammation or scar in the heart.
All right, final question. What are the symptoms of a heart attack that we should watch out for? And I know, like, my friend's mom, she thought it was indigestion, and she died of a heart attack.
That's right. So the symptoms do differ sometimes between men and women. The typical symptoms that anyone could experience include tightness in the chest, pressure in the chest, feeling like someone's pushing down on your chest, or just shortness of breath. Females are more likely to have heart attack without any of these symptoms or just with shortness of breath. And then, of course, they also specifically can experience nausea, dizziness, or fainting.
Interesting. All right, Dr. Jason Cuomo, we thank you for this interesting information on such an important topic, so widespread. We appreciate it.
Thank you for having me.